Welcome back. Well, now we've got at least 3 promising COVID vaccine candidates and more coming in the pipeline. But you wonder about the people that are participating in these studies because it's so crucial to the world getting a vaccine to get rid of COVID. So we're talking to one of those people today. That's Omar Yacoub, a longtime friend of mine. But also, I just recently learned, Omar, that you have been a volunteer for the Moderna vaccine. Is that right?
Correct.
Okay, so let's start at the beginning. Like, how did you even find out that there was a trial going on and then took the step to enroll in that?
Yeah, so I happen to have a scientist friend who works at Moderna.
Okay.
And as the company and others were ramping up the clinical trials and going through the phases, I kind of just said to my friend half-heartedly one day, like, I should volunteer. I'd want to be a guinea pig because I too always wondered, who these people were, what kind of attributes possessed people to do such a thing, right? And she immediately remarked that if she could take the vaccine, she would with no hesitation, and advised me to check out clinicaltrials.gov. So from there, it went from just kind of like a casual remark conversation to something planted in my head. And I subsequently told my brother about it, again, just as like a passing remark. And he's a single guy living in Nashville who's growing more, let's say, restless from all the social distancing. And like a few days later, he totally surprised me by he messaged me saying, I'm at the clinical center in Nashville and I'm getting ready to do this. And that was a total surprise to me. And by the way, he ended up doing it through Pfizer.
So I have a lot of questions. So first of all, I'm thinking about your parents. I mean, are they aware of this? Were they worried? What did they say?
Yeah, I mean, first they were like, oh my gosh, why are my kids so crazy? And why both of them had to do the same, potentially crazy decision at the same time. But they totally understand it. We explained to them the process. And furthermore, I mean, I live close to my parents, and they're not getting any younger, and I would feel pretty guilt-stricken if I had infected them or if I had been the cause for their COVID case, because I think that's inevitable the way things are progressing right now.
Okay, so you signed up, and then what? I mean, do you go into like a medical office and get a shot? Or, I mean, how does the whole process work?
So I did the online search, found the appropriate testing center in New York City, which in this case is Weill Cornell, and kind of the rest is history. So it's a 2-year study in its entirety. The first 2 visits, they draw 8 vials of blood. So that's the most blood that I've ever had taken each time. And then they do a very, let's say, thorough nasal swab, which, got to tell you, I absolutely love and wish I can do every single day.
I've heard about this. My daughter actually had one at school. So, okay. So this is like the thing that goes up in your brain.
Yeah, it's like the deep impact kind. Yeah. Yeah. And so after the first 2 visits, so I just completed the last one on Friday, I'll go again in a month for an additional blood draw. And then after that, there'll be 2 visits per year over the next 2 years. So 1 visit every 6 months for, interviews and I guess more blood draws, and really just to kind of measure the antibody levels.
Is it volunteer? Do you get any money at all for this?
Yeah, I would imagine that the earlier phases probably pay a lot more because there's more uncertainty, and different companies do pay different amounts. In my own experience, and this is probably different depending on which city and which company, but Moderna paid me $100 per visit. But New York City parking cost $45 to $55 for the time I was there. So
it's kind of like jury duty. It's like you're not doing it for the money.
I really didn't do it for the money. Yeah,
okay.
Correct.
All right. So you got a shot, and
2 shots.
You got 2 shots. Okay, because it is a 2-doser thing, right? So, and then they don't tell you whether it's the actual vaccine or placebo, but you did have a reaction.
Correct. It is, for the most part, it is a double-blind study. So meaning most of the doctors do not know whether what they're giving you. There are particular people there, but that know. But it is a double-blind study. But it is important to note that there are side effects, and so that I would say is probably one of the potential, I would say, drawbacks from at least Moderna and Pfizer's point of view that people should just be ready for. I wouldn't equate side effects to danger, at least based on the research I've done and the people I've spoken to. And secondly, I would say it's all short-term in nature, and so we're talking a range from pretty intense arm pain at the injection site to mild fever followed by aches and pains and chills, but lasting from like 12 hours to 20 hours tops. So if and when people decide to do it, just plan to take the next day or two off and kind of chill out and watch Willy Wonka.
And when I get a flu vaccine, I'll do it on a Friday, and that way, I don't have to get up and I don't have that intensity of work and things like that. So just kind of plan for it. Okay, so, well, I mean, it's amazing because, people are wearing masks and won't go out of their homes and they're so scared of this. And here you are putting yourself in this situation for the good of humanity, really. I mean, I don't want to, oversell it, but it's really what you're doing.
Yeah, I mean, for me, like I truly want to be part of something unique. What I hope will be like just a once in a lifetime experience, and kind of do my part for like to facilitate a history making solution, right? And to aid in the progress in ultimately bringing this awful situation to a close. But like all the credit should go to the medical staff and community first and foremost. And I guess, speaking to you today isn't about sending a message to those who are pro or anti-vaccines. It's really about accepting whatever unknown risks there may be on a personal level, and being able to just share that to whoever is interested or curious. And that's really it from my standpoint.
Just appreciate your sacrifice, Omar, for being a part of that.
No, it's an honor, and I hope we can speak in person sooner than later. And that's another.
Well, thanks again, and very interesting to have had a close personal friend go through this. So thanks, Omar. I appreciate you sharing the story.
Anytime.